My name is Dr. Anviola Nalugala, and this marks the beginning of a 5-episode, 5-minute checkup series on childhood cancer. Many childhood cancers are treatable, and some are even curable. But unfortunately, there are so many myths surrounding cancer, especially childhood cancer, and today I am here to help us dispel fact from fiction. I know when most of us hear about cancer, we think it's a total death sentence. And worse, when we hear about childhood cancer, you'll be just like, oh my God, why is this child getting cancer? And it can be so sad. But did you know that childhood cancer is not necessarily a death sentence? Early diagnosis is always key, especially when it comes to treatment and the curability of childhood cancer. Of course, you have to consider the type of cancer, the grade of cancer, how much it has spread, and the availability of treatment or not. But I want us to know, and I want to encourage any parent out there who is dealing with childhood cancer, that this is not a death sentence. Some of the questions we mostly hear in clinics is, maybe I fed my child wrong, maybe I vaccinated my baby, or maybe I did not pray enough. I want us to understand that there is nothing a parent could do or could not have done that might have predisposed your baby to getting childhood cancer. Childhood cancer is not known what exactly triggers it or what causes it. A lot of studies are ongoing, but there's not one clear-cut answer that we can be able to give you. But I want you to also know that it is totally different from adult cancers, where maybe it may be affected by lifestyle choices, lack of exposure, alcohol intoxication, or things like that. Parents, don't blame yourselves. You are doing the best that you can with your babies, and there is nothing that you could have done better to prevent this cancer or this diagnosis in your tiny one. If I stop giving sugar, will my baby's cancer disappear? This myth is usually brought about by the fact that we believe that cancer needs glucose for it to grow and multiply. That is not the case. Especially if you are diagnosed, I really advocate for you to follow whatever your pediatric oncologist is telling you in terms of the treatment plan. Sugar is not really associated with cancer. Babies who are diagnosed with cancer need proper nutrition, a good balanced healthy diet, and that can sometimes include sugar as well, or carbohydrates. These are not things that we have any evidence that will suggest will predispose a baby to getting healed from childhood cancer. Another myth I am here to dispel is that childhood cancer is contagious. No, childhood cancer, or actually any cancer whatsoever, is not contagious. You cannot get cancer the same way you can get a flu or a cold or COVID-19. It is not the same. Most of the children with childhood cancer really need love and affection because they're in such a vulnerable time in their life. Not only the children and tiny babies, but also the parents. We need to treat them with love and compassion. And finally, herbal use or herbal medication can replace chemotherapy. This is totally and completely untrue. Herbal medication is actually one of the things that I consider the banes of my existence, because our babies' kidneys and livers are not as strong or mature enough to process herbal medication the same way it will process in an adult or even a teenager. I would like to encourage all parents out there not to give herbal medication thinking that it is going to be a replacement for a particular form of treatment. If your child is diagnosed with cancer, the best thing is to follow the protocol you've been given by your pediatric oncologist in order to assure us for the better chance of treatment. Herbal medication is not something we advocate. In fact, it can cause more damage by injuring your liver and your kidney. Remember, the chemotherapy medication you're already giving is cytotoxic. It is already toxic to the bodies. We need our livers and our kidneys to be at the best possible frame of work, at the healthiest that they could be. and then you add herbal medication, it could tank the whole system down. Herbal medication should not ever be considered as replacement for any form of treatment, especially chemotherapy.